Now, I'd like to introduce the first panelist, Dr. Zakia Hossain. She is a demographer and health sociologist, and a senior lecturer in the School of Public Health Science at the University of Sydney. Dr. Hossain is the founding secretary of APSA and has contributed to the organization and conference. So Dr. Zakia, please get started. Thank you.
Good morning, everyone. Good afternoon, probably for some of you. Just as a secretary of Asia Pacific Sociology Association and a co-convener of APSA, I would like to welcome all of you in this two-day webinar, and also would like to thank panelists, those who are here across various regions, for your valuable contribution. I would like to thank our speakers, the speaker like Father Roberto, Dr. Melanie Robertson, Professor Joel, and Emma Porio. Thank you, everyone, all the participants as well. I would like to share my screen with the presentation that I'm presenting now. My talk is about impact of COVID-19 on women in the Asia Pacific region, some sociological perspectives. I'll be looking at globally as of 23rd of October, you can see that about 35 million confirmed cases of COVID-19 and 1 million, more than 1 million reported deaths. COVID-19 epidemic has been posing a serious challenge. It started in December last year, like 2019, and it spread gradually, and it became a serious health threat, health crisis for almost all over the world. It has various impacts, and the impacts we are experiencing every sphere of our life. I would like to start with a quote: "A profound shock to our societies and economies. The COVID-19 pandemic underscores society's resilience on women, both on the front line and at home, while simultaneously exposing structural inequalities across every sphere, from health to economy, security to social protection." As we know that COVID-19 experience is very different, and it has all the different regions are experiencing it at a different level. In the Asia Pacific region and all other regions, you can see that from January that cases were not very much, but gradually you can see that confirmed cases are really high in many countries and many regions. For example, if you can see that Asia, Latin America, and North Americans are the one where we can see that, as well as in Europe. I will focus some of these with India and Bangladesh. Few of these Southeast Asian countries are experiencing COVID-19 severely. For example, Bangladesh, Philippines, Pakistan, and Indonesia, India as well. And the death rates also vary more than 10,000 and some countries, but others are experiencing it at a different level. Now, next thing is, we know that COVID-19 government and organization, international bodies, we have started several different measurements: lockdown, closed, and isolation, social distancing, using masks, and all sorts of things. And it has different impacts as well. And there are other measures that has been also taken. That measures are, for example, there are other measures such as affordable healthcare, sickness benefit, unemployment protection, old age support, and income support, and family leave, and many more. There are 8 other measures that has been taken, and different countries in the Asia Pacific region are using, or not every country can afford all of them. Many countries, for example, Philippines, Australia, New Zealand, and also we see many other countries, for example, are using most of them, but other countries cannot afford all of them, all measures. Now we look at COVID-19 impacts. As we know, the impacts in different regions are different, and also in different population groups. My talk is about the women and particularly women's how they're experiencing. The pandemic is deepening pre-existing inequalities, exposing vulnerabilities in social, political, and economic systems, which are in turn amplifying the impact of the pandemic. We are looking at women and women's employment and financial situation. Women work in informal sector. As we see that 740 million women are employed in the informal sector, 2/3 of them are female. And if you look at this employment, because of the lockdown, most of these jobs quickly disappeared. And we also see that because of the closing down, small businesses and some other factories and garment industries has a negative, very huge impact. And most of these garment industries workers are female. In Bangladesh, Cambodia, Myanmar, small garments factories witnessing these job losses among women. And if we look at the next one is about financial situation women are experiencing during this COVID-19. As we know, women are save less and holds less secure job. They have less social protection as well. Women's domestic workload has gone up, and because of the COVID-19, their workload, unpaid care and domestic workload has increased severely. Women are bearing triple burden, and that is particularly childcare and child education and care for the sick. Education is because of the lockdown, many schools closed, and that closure of school is because and children are at home, so women are taking more responsibility of educating children. And we see that 1.5 billion children attending school cannot attend because of the COVID-19. And because of that, they're attending school home education, and that is provided by women. The other thing about the abuse and domestic violence experienced by women, World Health Organization reported that in 2013, about 35% of women of the world are subjected to violence by their partners or husbands. More than 80,000 women killed in 2017, and most of them are violated by immediate family members. India is reporting a lot of violence, and 600 calls are because of the domestic violence. And during this time, we see many countries are experiencing violence, women experiencing violence. Some of the factors are because of they're living in the cramped house, living with the abuse partners and others. There are gender differences in terms of various other activities. You can see that all these income differences and also unpaid work and caregiving, gender differences are quite clear. And there are some qualitative findings suggesting that a girl, for example, in here quote, a girl staying at home during COVID-19 has, I have more work to do, struggling with new study models online. Looking at all these, actually talking about how women are experiencing various health challenges, various economic, financial challenges, psychological distress, the policy recommendation, we would like to suggest that there are some support that can be provided to women to overcome the financial crisis, psychological distress, for example, universal basic income, which is a program that has been practiced by various countries. And it is a successful program, and some countries are providing some cash to women so that they can minimize their job loss and also minimize their financial crisis. Government commitment is very important, and so we need to see that governments are doing more in terms of improving gender inequality and women's vulnerability. Education program, for example, virtual program is very important, and circular radio program. For example, the virtual program is very important that we should avoid violence against women and warn early detection of violence and domestic violence to minimize those. And talking about this, how we can do work collaboratively internationally, we need more research. Therefore, we'll be looking at collaboration from participants, from the presenters. Thank you so much.